Welcome to our presentation. This is Research Ethics Related to International Research by Michelle, Paula, and Logan. So these are some of our presentation objectives. So why do researchers go to another country? Typically, the prevalence of disease is greater in other countries for a number of reasons, but foremost, lack of access to resources. This stems from differing standards of care throughout the globe. For example, although the global standard of care for an infant with sepsis is IV antibiotics and supportive care, the common standard in Gadchiroli, India, used to consist of no medical intervention. We will discuss this example further in the coming slides. So what are some of the issues that American researchers face when conducting their research in other countries? They heavily revolve around community participation. It is vital for researchers to embrace the culture of those around them and have their interests above the potential for scientific gain. It is also important that researchers adhere to any agreements made with local leadership. They should also be sure to deliver any benefits promised to the participants and the community as a whole. As mentioned in the previous slide, standards of care are not as universal as their name conveys. In some areas of the world, they are unattainable even in the most urban sections. Further, the use of placebos in experimental research has been called into question by ethicists. We will explore this issue further throughout our presentation. Recently, there was a trial in Gadchiroli, India, that called a lot of attention in the ethics community. Researchers were interested in community-based health workers giving oral trimethoprim sulfamethazole and gentamicin to newborns suspected of having sepsis. They utilized a control method and showed a 72% reduction in infant mortality with their new regimen. Because it used an experimental design and control population, when the national standard of care for neonatal sepsis is IV antibiotics, the ethics of the trial were called into question. The researchers engaged in ethical and scientific review process prior to conducting the study and also involved local officials, including the Indian Council for Medical Research. The community voiced support for this study because even the national standard of care was unavailable to these participants. Therefore, the research benefited both the researchers as well as the community, where the common protocol for suspected sepsis was no action. Had the study been required to provide IV antibiotics and hospitalize the control patients, it would not have existed, as this care is unavailable to be performed even in urban areas of India. The trial established that every developing country should have the ability to find interventions that meet their needs. However, on the flip side, it needs to be ensured that researchers are not taking advantage of this vulnerable populations by conducting researches that will not benefit the community.
In order to properly consider the guidelines that regulate and define our policies on international research ethics today, we must start at the beginning. In the 5th century BC, Hippocrates, the Greek physician widely considered the father of medicine, brought patient safety to the forefront by declaring that all patients had rights. It wasn't until the 1800s that more progress was made, and Claude Bernard, a French physiologist best known for the concept of homeostasis, stated if harm is going to come to a research subject, they should have at least considered to the research. In 1947, research ethics came into the limelight again. The Nuremberg Code was published in response to Nazi scientists performing inhuman experiments on concentration camp prisoners. The Nuremberg Code established that nobody can be forced to participate in human research. 17 years later, the World Medical Association developed the Declaration of Helsinki as a statement of 12 ethical principles for biomedical research. Although ethical guidelines existed in the 1900s, they were not fully implemented by some researchers. A classic example is the Tuskegee syphilis study, where researchers intentionally withheld treatment from African American patients. This led to the development of Belmont Report in 1979. The report outlined three principles: beneficence, justice, and respect for persons. The primary goal of the principles were to protect participants in research studies. In 1982, the Council for International Organization of Medical Science, in conjunction with WHO, developed guidelines for international research in developing countries. The current version of the guidelines was released in 2016. The scope of the 2016 version, which is made up of 25 guidelines, encompasses health-related research with humans, such as observational research, clinical trials, biobanking, and epidemiological studies. The latest edition of the International Compilation of Human Research Standards also lists laws, regulations, and guidelines on human subject protections in 131 countries. Also, the Office for Human Research Protections aims at protecting the rights, welfare, and well-being of study participants involved in research conducted or supported by the U.S. Department of Health and Human Services. There are also program-specific ethical guidelines, such as HIV Prevention Trials Network Ethics Guidelines for Research, which was revised in 2009. HIV prevention, the Joint United Nations Program on HIV and AIDS, Ethical Considerations in Biomedical HIV Prevention Trials, and Good Participatory Practice Guidelines for Biomedical HIV Prevention Trials.
International research agreements results in data that ranges from financial and consumer data to Earth and space data, population and health data, to generated data that is specific to cases such as sepsis, as Logan had mentioned earlier, to cases of euthanasia, and predictability of HIV in certain communities. How that data is used requires someone taking accountability for the effects of how the data is accessed, how it is used, and how it is shared. Additional considerations of cultural, legal, policy, and technical concerns are also vital determinants of what can be done to maintain privacy, confidentiality, and security. Ethics is a lens through which the issues of data, data sharing, and research agreements must take precedence. Vital to international research is the engagement of community. The Joint United Nations Program on HIV and AIDS, or UNAIDS, is the main advocate for accelerated, comprehensive, and coordinated global action on the HIV/AIDS pandemic. These guidelines for research set the best practice guidelines for conducting research, and they emphasize the inclusion of community where the research is being conducted. Understanding what is important to the community, their understanding of research, and the resources available must be considered. Dr. Cass identifies two ethics challenges that, when conducting international research, must be considered. Those two ethics challenges are: one, informed consent, and two, justice and human research. Informed consent and research are everyday terms for the United States, but for many underdeveloped countries or territories, it's not a common term. In a study conducted by Cass, she and some colleagues, they did 6 trials in 3 different countries. And they did a qualitative study. They were interested in knowing what people were understanding when they're participating in the research. Now, they had to use an interpreter. Now, these weren't highly trained, they weren't professional interpreters, so they had to do the best with the circumstances, under these particular circumstances. Their hope was when they questioned the participants, that it was interpreted correctly, and then when the interpreter interpreted the answers, they were interpreted correctly as well. So what is research was one of the questions they asked the participants, and they got a variety of responses. One person responded, it's an activity about medications, and yet there was one other person, when asked, what is research? The response was, research project. They build houses. So it wasn't interpreted that the participant really didn't understand what research was, but when the question was asked and how it was interpreted, it came back that the research was about building houses. The same goes for informed consent. With informed consent, it's very important that the participant understands what he's consenting to. So the question is, who should be involved? What participants should really be involved? What is going to be required for legal pieces? One of the greatest challenges is obtaining informed consent, as mentioned in the prior slide. So what needs to be done or what needs to be considered when obtaining consent in international settings? Dr. Cass actually suggests 3 things. 1, we can do group presentations. It's like a group presentation of what the research is going to be about, and then it's followed by individual conversations with those participants who are going to be part of the study. The second suggestion is presenting it in a non-intimidating fashion, and that's choosing words wisely, choosing those words that your participants are going to understand, choosing words that are familiar to the particular culture you're working with. And then a third suggestion is using that media to get the word shared. Barriers to consent must also be expected and addressed when obtaining informed consent in international research. So the question is, what kind of consent how are you going to get this consent? What kind of consent? When we consider oral consent or written consent, drama, or via video, what needs to be understood is that there's as high as 80% of those participants are illiterate. 60% of our surveys or of our consents are still written consents. There needs to be consideration of the community involved when we're getting this and what their knowledge is when we're obtaining informed consent. The basis of our study is not going to be understood. If it's not understood, consent is not going to be adequate. So the second challenge identified by Dr. Cass when we're dealing with these challenges of international research is justice in human research. What is fair to the participants? This is the second biggest challenge. It's certainly a concern in the United States, but when considering international research, fairness would be determined by such factors as resources available, especially for post-trial considerations, and determining if that research proves justice for the participants, or is it just based on the researcher. Justice, by definition, is fair selection of the participants. This will be an ethical concern in the case study in the following presentation.
So we did a case study on the Burrcrest Early Intervention Project. It was actually the first ever randomized controlled trial of foster care as an alternative to an institutional care for young abandoned children. The ethical issues in the conceptualization and implementation of the study included American investigators conducting research in another country on extremely vulnerable participants. The study took place between 2000 and 2005, and its whole purpose was to determine whether receiving young children from removing them from institutional care and placing them in foster care would enhance their outcomes. And they assessed that through brain and behavioral functioning. So this was their methods. They used 3 United States principal investigators, and they partnered with a non-governmental agency in Romania, where the study took place. They assessed the infants and children, created a network for the foster care system, and they developed an administrative structure to provide organization. The measurements include comprehensive developmental follow-up assessments of the brain and behavioral functioning in children once they turned 8, and they followed them until they turned 12. So why did these principal investigators choose Romania? Why couldn't the study be conducted in the United States? So in the governmental system of Romania, this was not as stigmatized because the government suggested that the state could raise children more effectively than the parents. and as a result, there are tens of thousands of children being raised in state-run institutions. So in the United States, we have a different set of policies and how children should be cared for. United States says that children should be raised in families rather than institutions, and if institutions are necessary, they should be situated as family-like as possible. However, in contrast, the Romania at the time of the onset of the study, the question of foster care versus institutional care was far from settled. There was a lot of controversy about it. In fact, investigators were originally invited to conduct the study by the Secretary of State for Child Protection in Romania because of a debate there was about there was a debate about the most appropriate care for these abandoned children.
So the key points of this, the key issues in this case study are similar to those in other international studies. One, the nature and location of the vulnerable study population. That was a key issue. And Logan mentioned about the Romanian government. Two, social value of conducting the study. How valuable was it really going to be for this community? The risks and benefits of participating in the study. You're taking children out of where they were into from an institution and placing them with families in a home. Post-trial obligations of the investigation, which I will address in the next slide, and linking scientific practices with meaningful ethical protections for the participants. Now keep in mind, we're one, dealing with that vulnerable population of children for one, and then two, in an underdeveloped country. So before instituting a plan to undertake research in this population or community, the sponsor, the researchers, and relevant public health authorities must ensure that that research is responsive to the health needs of those participating in the study. So as part of this obligation, sponsors and research must also make effort in cooperation with the government and other relative stakeholders. They need to make available as soon as possible any intervention or product developed and then any knowledge that's generated. So if the researchers are going to conduct this somewhere international, they need to assure that after the research is over, one, the results are going to be shared, and two, that we're not just going to let the participants go back to the way they were, into whatever situation they may have been. So every effort must be made available. Any intervention, any product developed, and any knowledge generated must be shared. This guideline pertains to settings in which resources are so limited that the population may be vulnerable to exploitation by sponsors and investigators from wealthier countries and communities. In this particular case, there were reasonable concerns about the investigators who study high-risk or vulnerable populations. Their concern was, are we going to be able to support these children after? In this particular study, the investigators were able to obtain $900,000 in startup funding for the creation of a child development institute in Bucharest. They wanted to ensure that no child randomized to foster care would be returned to institutional care after the study ended. They made every attempt to negotiate agreements to support foster homes after the study concluded. 4 of the 5 sectors agreed to this condition.
So now we can draw some conclusions. First, international research ethics is a process that has and continues to evolve over time. We still have regulatory issues that must be resolved to conduct ethically sound research in developing countries. We have gone over examples in which research within developing countries can be beneficial to the researchers and the local community. Hence, researchers must ensure that study participants are always safe. As we move into the future and research grows more complex, researchers must be more cautious than ever to not only follow ethical guidelines. They should ensure that their participants and their communities are receiving the benefits of research conducted, as these groups often have health disparities and lack access to basic health measures. The challenge to international research ethics is to apply universal ethical principles to biomedical research in a multicultural world with a multiplicity of healthcare systems and considerable variation in standards of healthcare. Should journals accept more quasi-experimental designs? Should more financial support be available for longer studies? Now, our discussion question. Should we develop tighter regulations regarding standards of care in international research ethics? Why or why not? What is the extent of researchers' responsibility for caring for their participants or the community as a whole?
These are just our references that we use throughout the presentation. Thank you for your time and attention.